Today topic is Bell's palsy. So before going to the topic, you all know what to do. So don't forget to subscribe the channel. If you have any doubt, please ask in comment section. So let's see. Okay. So Bell's palsy is also known as facial palsy or paralysis of the face. So it is a seventh cranial nerve disorder. Okay. So next one is the definition. So it is a disorder. So it is a disorder of characteristics affecting the seventh cranial nerve. Okay, so it is usually affects the seventh cranial nerve. Okay, seventh cranial nerve, which is seventh cranial nerve is a facial nerve. Okay, so it affects either unilateral or bilateral loss of motor and sensory function. Okay, so it is a disorder which affects the seventh cranial nerve, which is a facial nerve. So it there may be a unilateral or bilateral loss of motor and sensory function. Okay, so next one is causes. So in causes, first one is due to brain tumor. Okay, so and second one is hematoma, and then third is stroke. So fourth is due to bacterial infection and virus like herpes simplex and herpes zoster virus. Okay, and muscle weakness of face in face. Okay, and Epstein-Barr virus. So these are the causes of Bell's palsy. So next we are going to see pathophysiology. So in pathophysiology, due to etiological causes, okay, due to etiological causes, it leads to innervating of the muscle. Innervating means supply with the nerve. Okay, innervating of the muscle of motor and sensory system. Innervating of the muscle of motor and sensory system, it leads to weakness of the muscle. Okay, so due to weakness of the muscle, it leads to drooling of salivation. Okay, drooling of salivation and dropping of the eyelids, drooping of eyelids. Okay, so due to drooling of salivation and drooping of eyelids, it leads to the loss of the taste sensation. There may be a loss of taste sensation. Okay, in 1/3 or 2/3. Okay, in affected side. Okay, loss of taste sensation in the affected side, it may be 1/3 or 2/3. Okay, so next it leads to inverted eyebrows. Okay, so inverted eyebrows leads to facial muscle weakness or paralysis of the face. Okay, so this leads to Bell's palsy or facial paralysis. Okay, palsy or facial paralysis. So this is about pathophysiology. One is clinical manifestation. So in clinical manifestation, first one is muscle wasting. Okay, and second one is loss of muscle movement in face. Okay, so and third one is changing the facial expression. And fourth one is expanded eyebrows and eyelids. Okay. And fifth one is loss of sensory function, like there may be a loss of taste and touch. Okay. Loss of smell and difficulty in chewing. Okay. So, and dysphagia means difficulty in swallowing. Okay. So next, flattening of the nasolabial fold. Okay, which means the smile lines. Okay. So next one is diagnosis. What are the diagnosis of Bell's palsy? So let's see. So next one is diagnosis. So in diagnosis, first one is EMG, which means electromyography. So it uses to measure the electrical activity of the muscle. Okay. So this test is to confirm the presence of nerve damage. Okay. So EMG is done to confirm the presence of nerve damage, and it also determines the severity. Okay. So EMG means electromyography. Okay. So this the presence of nerve damage, and it also determines the severity of the damage. Okay. So it also to assess the myelin sheath of the brain. So this test is done. Okay. So next one is imaging scan. Okay. In imaging scan, MRI and CT is done. Okay. So it is needed to rule out the pressure of the facial nerve. Okay. To find out the pressure of the facial nerve. Okay. So next one is TENS, which means transcutaneous electrical nerve stimulation. Okay. So these are the diagnosis of Bell's palsy. So next we are going to see about the management. So in management, first one is medical management. In medical management, corticosteroid prednisolone will be given. So it is a powerful anti-inflammatory agent. Okay. So next one is botulinum sodium will be given, and next is antiviral drug acyclovir will be given. Okay. Okay, so next one is administration of IV fluids. A DNS will be administered, and antibiotics cefotaxime 1 gram in IV or BD for 3 days it will be given. So next one is nursing management. So in nursing management, hot application will be given, and chewing activities should be done. So improving the level of muscle tone. Okay. So next one is a reassessment of tense should be done, and physiotherapy exercise. In physiotherapy exercise, rotation of tongue will be done, and follow-up care. The follow-up care will be done for 1 week. Okay. So next one is nursing diagnosis. So nursing diagnosis, first one is impaired sensory perception related to facial movement. Okay. So as evidenced by weakness of muscles, you can add anyone. So due to second one is acute pain due to chewing unilateral related to pain during the chewing process. Okay. Next one is complication of Bell's palsy. So in complication, there may be a corneal ulceration, corneal perforation, and impairment of vision. So these all about Bell's palsy. If you want extra content, you can refer book. Thank you.